hospital, whatever the reason, he examines the kid, it turns out to be a month later, and now he hears a murmur. He did hear it in the hospital, hears it a month later. Did the doctor miss something, or could this be the way things happen?
I think it could be the way things happen. It's important for people to realize that a heart murmur in of itself is a finding, not a symptom. Most heart murmurs at any age, whether it be in the neonatal period, right after birth, a month of age, 2 months of age, usually you don't pick up murmurs when the child's screaming only at 10 months of age. But at 5 years of age, heart murmurs usually are normal or innocent murmurs. First thing that's very important. Now, there are certain cardiac conditions where you're more likely to pick up a murmur at a month of age. For example, a hole in the heart may be missed in the first couple of days of life, which you'll pick up at a month of age. Generally speaking, blocked valves, they're blocked from birth. You usually hear that murmur even in the neonatal period. But it certainly would not be uncommon, as we mentioned, about what we call hemic murmurs. Murmurs that are secondary to the fact that the baby's hemoglobin hematocrit is lower at a month than at a day. It would not be uncommon to hear what we call a hemic flow, which is also a type of innocent murmur, at a month. The other kind of murmur that you may pick up, if you have a baby who was born prematurely, and we're not necessarily talking about very premature, but let's say a baby 4 pounds at birth, 4.5 pounds at birth, and suddenly in a month this baby's gaining weight like crazy, and you listen and you hear a murmur. That is a form of functional murmur which is caused by rapid growth of the pulmonary arteries. What happens is, inside the mother, inside the growing fetus, the pulmonary arteries are not getting very much blood because the mother is supplying the oxygen through the placenta. After birth, when the baby is born, you suddenly have a mismatch between a large central pulmonary trunk and the branches. It's like a big trunk and the branches of a tree. As a baby grows quickly, the output of the heart needs to increase. And as the baby is pumping more and more blood through this big trunk, and the blood is trying to get to the lungs through these smaller vessels, often you'll get turbulence and you'll get a murmur of what's called peripheral pulmonic stenosis. It's a normal phenomenon you'll see. The murmurs are usually heard best over the lungs, possibly in the back. And these are murmurs, again, that are a form of functional murmur and which will go away. Now, if it sounds bothersome to the primary care provider, it's not unreasonable to refer that child for an evaluation to a cardiologist. But that is one of the common causes of murmurs that a pediatrician may pick up at a month of age rather than as a newborn.
So in other words, don't be upset if it's picked up a month of age, because many times you can't pick it up.
I think the important thing is, like everything else, it's common sense. It's important to reassure a mother or father who has a healthy newborn. Child's eating, growing, looks well, no respiratory distress, is not blue, looks like a nice healthy baby. If you're hearing something in the heart at a month of age, the likelihood of this being a terrible life-threatening problem are very remote. Not to say you don't refer it for evaluation, but reassurance is very important. We see so many families that come in and they've lost sleep for a week waiting for their appointment because their doctor told them there was a heart murmur. So reassurance is important. The key findings, the key part of the examination for the primary care provider are basically respiratory rate, weight gain. Very important to feel femoral pulses. That's something that pediatricians need to learn to do so that they are convinced the baby doesn't have a blockage in the aorta. But if you've got a baby who looks comfortable, is pink, is gaining weight, is feeding well, is comfortable, and has good pulses, that's a baby that can see a cardiologist for a murmur, but there's no reason for that pediatrician to panic. If they see a baby at a month of age who's not growing, who's breathing hard, who's uncomfortable, that murmur may represent something significant. The reverse is also true. If you see a baby without a heart murmur, and the baby looks sick and is in respiratory difficulty and not gaining weight, that can be a heart condition with a very large hole and no murmur. So the presence or absence of a murmur is not a substitute for a good history and a good physical exam.
Thank you very much.